University of Western Australia has launched a world-first statewide campaign to embrace the arts when it comes to their mental health and well-being. The Good Arts, Good Mental Health is asking people to look into the arts activities by offering a free 5-day arts challenge. Dr. Christina Davies is Director of the Centre for Arts, Mental Health and Wellbeing WA within the School of Allied Health at the University of Western Australia and joins me now. Dr. Davies, welcome.
Thank you. Hello.
Hello. Now, look, we've long known that exercise and sport is pretty good for your mental health, but what does the science tell us about how artistic endeavours such as, dancing, singing, painting, clay throwing, how does that impact on our well-being?
Sure. Well, look, there is strong evidence of an arts-mental health relationship. And not only that, but we also know now the arts dose. So there is a link between 2 hours per week of arts and good mental wellbeing. And so what we're trying to do in Western Australia is to empower people with the knowledge that by engaging in the arts that they love, that they could be impacting their mental wellbeing. So things like happiness, joy, relaxation, connection to other people.
Connection's a big one, isn't it? Before I ask you about the program, can I just ask you a bit about how, we obviously as a globe went through a pretty big change recently with the pandemic. Do you think it's now more important than ever that we incorporate art and artistic endeavours into our lives?
Sure. Look, we do have a national mental health crisis at the moment, and absolutely things like COVID, social, economic inequities are all impacting. And, the arts is such a great strategy that we could be using for our mental wellbeing. And what's also, is really important, the good arts in the Good Arts, Good Mental Health is about doing the arts that makes you feel good. So it's about the arts that you really connect with. So, one person might like to paint, someone else may like to sing. It's about what you enjoy doing and what suits your lifestyle and your budget. But what's really important, in all of this is that you don't have to be good at arts for the arts to be good for you. It's just about having a go, having a laugh and, connecting with other people.
So tell me about this month-long campaign that's being run in Western Australia. How do people be involved? Is it structured? Is it pretty loose? Tell me a bit about that.
Sure. So we've had a few demonstration programs. You might have seen us at the Western Derby. Also, we've also got things like, radio, social media. Also on, we've got the campaign website. So there's lots of things that people can do on the website, which are low cost, no cost. So even things like, say, our 5-day challenge, if people don't know where to start when it comes to the arts, we've got a 5-day challenge on the website, which means that people can kind of step through each day. So day 1, say, is listening to your favourite music. Day 2 is colouring in, and you can download colouring in from our website. Day 3 is photography, so taking a photo on your phone or a camera if you have one. Then day 4 is origami, day 5 is reading, and from the website you can, if you're in Western Australia, there's also a link so that you can actually find your local library.
So what if someone thinks all those things that you just mentioned there, I kind of like the idea, but I'm just no good at it, and people don't generally like doing things that they're no good at. What do you say to them?
Oh, look, and that's why, this the comment of you don't have to be good at arts for the arts to be good for you is so important. As children, we sing and we dance and we draw, and, that happiness and joy that comes from those sorts of things, we really connect with, and then we kind of grow up. And suddenly we feel like we need to be good at it, otherwise we shouldn't be doing it. But it's just not true. Like, if you think about your favourite songs, if you're having a hard day, you could be listening to your favourite songs, or, even things like just changing the idea that, say, if you're feeling really stressed, someone might go for a run. But what we're trying to do is to empower people and to let people know that there are a range of other things, arts-related things that you could be doing, like you could be doing a colouring in, you could be listening to your favourite music, you could be going to, a concert with friends to connect with the friends and family. So this is just about, I guess, giving people new tools in their mental health toolbox, and they are arts-related.
And just finally, Christina, how will this program be measured to work out if it's a success or not, and then potentially if it might spread elsewhere?
Sure. So this is evaluated. So we have an independent evaluator evaluating us. We're looking at awareness, comprehension, acceptance of the message, intention to act on the message. So all of those things, will of course look at whether we've been successful in terms of promoting the Good Arts, Good Mental Health message. But one of the things that we're finding already is that this campaign has been developed by the people for the people. So to develop this campaign, we've talked to more than 3,000 people in terms of the words they like, the images they like, you know, how we should be getting this message across. And, you know, at events that we've been at already, you know, we're getting intention to act at 65%, which, you know, is amazing that, you know, this could be a new tool for 65% of people for their mental health.
Wonderful indeed. Keep up the singing in the shower at a bare minimum. Dr. Christina Davies, thank you.
Absolutely. Sing in the shower.